Hello everybody. My name is Harmandeep Jasar and today I'm going to present on medication nitroglycerin. So nitroglycerin is a nitrate from anti-anginal class. What are the indications of this medication? When the patient having a chest pain, for the management of chest pain, you can give this medication. We can give nitro PO when the patient having a heart failure, or IV nitro for a patient having acute MI. And it is also used in the production of controlled hypotension during surgical procedures. What is the action of nitroglycerin? This medication increases the coronary blood flow by dilating coronary arteries, which improves the collateral flow to the regions which have low blood, and also producing vasodilation. It decreases the preload and afterload of the heart, which reduces the myocardial oxygen consumption. Now we are talking about side effects. What are the different side effects of nitroglycerin? Hypotension. Client can experience tachycardia, headache, blurred vision, dizziness, restlessness, and weakness. This slide is showing us the different types of available forms of this medication and different routes, and their corresponding onset, peak, and duration. But in this presentation, I'll mainly focus on sublingual nitro. So onset of sublingual nitro is 1 to 3 minutes. Peak is still unknown, but the duration is 30 to 60 minutes. What is the available dose for sublingual nitrate? In market, available dose is 0.3 to 0.6 milligram, but mostly tablets are available in 0.4 milligram and may repeat every 5 minutes for 2 additional doses for acute attack. So this is how acute relief of chest pain due to CAD, which is coronary artery disease with nitro. You can also use this prophylactically 5 to 10 minutes prior to engaging in activities where we know the person can experience a chest pain. Let's talk about dietary. No alcohol, no drugs, no cocaine when you're taking nitro. Patient is usually eating a normal diet unless your patient's doctor prescribes them specific diet. What are the different drug-to-drug interactions for nitro? Severe hypotension can result when nitrates interact with alcohol. So don't drink alcohol with nitros. Viagra should not be taken within 24 hours of nitrates because of possible enhanced hypotensive effects. Absorption of sublingual nitrates will be delayed when you take them with anticholinergics. Also, same thing with calcium channel blockers and nitrates. Patient will have orthostatic hypotension. So don't take calcium channel blockers, anticholinergics, no alcohol, and no Viagra when the patient is taking nitroglycerin. Oops, what happens if you miss the dose of nitro? Take the missed dose as soon as you remember. But if your next dose is within 2 hours, then just don't take it. Then take your scheduled dose, which is after 2 hours. Do not double the doses of the medication, and do not discontinue medication abruptly because patient can have rebound angina. What are the different teachings to the patient? We're going to instruct the patient as a nurse that to take the medication as directed by the doctor. Even if there is no pain, still take the medication. Also, educate the patient that this medication will cause hypotension. So, please change position slowly to minimize orthostatic hypotension. No alcohol. We're going to inform the nurse that headache is a common side effect of nitroglycerin, so it will usually go with aspirin or Tylenol. Advise the patient to notify the doctor if patient experiences dry mouth or blurry vision. As our main focus is on sublingual form of nitro, we're going to inform the patient that patient should keep the tablet in an original container or in a specifically made container for the nitro to prevent absorption. Instruct patient not to open bottle frequently until unless he needs it. Do not keep medication next to your body because your body heat can reduce the potency of the medication. Replace your medications every month. Usually nitro's expiration date is within 4 to 6 months. So no exposure to heat. Avoid exposure to heat, air, or moisture for your tablets. Otherwise, tablets will reduce the potency. Assessment. So what assessment we're going to do when the patient is taking nitroglycerin? We're going to assess the location, duration, intensity, and factors for patient's pain. Monitor vital signs before and after you administer the medication. If the patient is receiving nitro by IV, patient should have continuous blood pressure and continuous ECG monitoring. What are the potential nursing diagnoses? Acute pain and ineffective tissue perfusion. Desired outcomes: decrease in frequency and severity of anginal attacks, treatment of heart failure associated with acute MIs, and controlled hypotension during surgical procedure, which is increase in activity tolerance. So these are the reference slides. I used our drug book and our textbook from Levi's. Thank you.